These are the most powerful digestive herbs that can transform your gut health and eliminate bloating naturally. More than 40% of people worldwide suffer from functional gastrointestinal disorders, yet the solution might be sitting in your spice cabinet right now. Your gut is often called your second brain for good reason. This complex ecosystem houses trillions of bacteria that influence everything from your digestion and metabolism to your brain health and immune function. When this delicate balance is disrupted, you experience bloating, gas, cramping, and digestive discomfort that can significantly impact your quality of life. But here is what is remarkable. Herbs contain specific bioactive compounds that can restore digestive harmony in ways that modern medicine is only beginning to understand. These are not just kitchen seasonings, they are concentrated medicine that have been healing digestive issues for thousands of years. Let's start with peppermint, the undisputed champion of digestive relief. Peppermint contains menthol, a powerful compound that acts like a natural muscle relaxer for your gut. When you consume peppermint oil, the menthol blocks calcium channels in your smooth muscle cells, causing them to relax. This reduces intestinal cramping and allows trapped gas to pass more easily. The clinical evidence for peppermint is absolutely stunning. In one study of 72 people with irritable bowel syndrome, peppermint oil capsules reduced IBS symptoms by 40% after just 4 weeks, compared to only 24% with placebo. But here's the kicker. A meta-analysis of 10 clinical trials involving over 1,000 patients found that peppermint oil was so effective, you only needed to treat 3 patients to see one experience significant improvement. That's better than many prescription medications. The American College of Gastroenterology now recommends enteric-coated peppermint oil as the safest treatment for IBS. Research shows it can actually be more effective than fiber supplements and works at least as well as pharmaceutical antispasmodic medications, but without the side effects. To use peppermint therapeutically, steep fresh or dried peppermint leaves in hot water for 5 to 10 minutes and drink 1 to 2 cups daily between meals. The key is timing. Drinking peppermint tea before and after meals maximizes its digestive benefits. Now let's talk about ginger, the ancient powerhouse that's been used for thousands of years in Ayurvedic and traditional Chinese medicine. Ginger works differently than peppermint. Instead of just relaxing muscles, it actively stimulates your digestion. Ginger boosts the production of digestive enzymes, increases bile secretion, and speeds up gastric emptying, essentially helping food move through your system more efficiently. Recent research confirms that ginger is the superior choice for fighting nausea and vomiting, while peppermint excels at relieving intestinal spasms. A fascinating study found that ginger supplements significantly reduce dyspepsia symptoms, including that uncomfortable feeling of fullness after eating, stomach pain, and heartburn. Animal studies show that ginger accelerates gastrointestinal transit and reduces intestinal cramps, bloating, and flatulence. The German Society of Gynecology and Obstetrics suggests doses of up to 1,500 milligrams daily for pregnant women experiencing nausea, highlighting its remarkable safety profile. Fennel deserves special recognition as one of nature's most effective anti-bloating agents. Those tiny seeds are packed with anethole, a compound that is chemically similar to dopamine and has powerful antispasmodic properties. Fennel seeds are also high in insoluble fiber, which helps prevent gas buildup in the first place. The research on fennel is particularly impressive for infant colic, but its benefits extend far beyond babies. A study found that a fennel oil emulsion eliminated colic in 65% of infants in the treatment group, compared to 24% in the control group. That means you only needed to treat 2 babies with fennel to see one dramatic improvement. Here is a practical tip from traditional medicine. Chew on half a teaspoon of fennel seeds after meals for 5 to 10 minutes. This is not just folklore. It is based on the understanding that fennel's volatile oils need to be released to work effectively. You can also prepare fennel tea by steeping crushed seeds in hot water. Turmeric and its active compound curcumin represent the cutting edge of gut health research. What makes turmeric fascinating is not just its anti-inflammatory properties, it is how it actively reshapes your gut microbiome. Studies show that curcumin-treated groups had an average increase of 69% in detected beneficial bacterial species, while placebo groups saw a 15% reduction. Curcumin increases beneficial gut microbes like Lactobacillus and Akkermansia, while decreasing harmful bacteria. This leads to reduced gut inflammation and improved gut barrier integrity, essentially healing your intestinal lining from the inside out. However, curcumin faces a significant bioavailability challenge. Recent research shows that novel delivery systems can increase curcumin absorption from 50% to over 85%, making supplementation much more effective. Chamomile might be famous for its calming effects, but it is equally powerful for digestive health. About 1 million cups of chamomile tea are consumed daily, worldwide, and for good reason. Clinical studies show chamomile significantly decreases the severity of flatulence, even after surgery, and reduces irritable bowel syndrome symptoms, including bloating and abdominal pain. What is particularly interesting is that children with mild diarrhea recovered more quickly when treated with chamomile mixtures, suggesting its benefits extend beyond symptom relief to actual healing. Let me introduce you to some lesser-known digestive heroes. Slippery elm and marshmallow root are mucilage herbs that form protective coatings in your digestive tract. Marshmallow root acts like a soothing balm for heartburn, coating your esophagus and stomach lining to form a barrier against stomach acid. Slippery elm has been used by Native American tribes for centuries and acts as a prebiotic, creating an environment where beneficial microbes can flourish. Dandelion root, often dismissed as a weed, is actually a gentle yet effective remedy for constipation. It is rich in inulin, a soluble fiber that promotes regular bowel movements, and it stimulates bile production for better fat digestion. Here's what many people do not realize. Herbs work through multiple mechanisms simultaneously. While pharmaceutical drugs typically target one pathway, herbs like these contain dozens of bioactive compounds that work synergistically. This is why herbal preparations can control multiple treatment targets of digestive disorders relatively safely. But we need to address important cautions. The myth that natural equals safe can be dangerous. Peppermint oil can weaken the lower esophageal sphincter, making it inappropriate for people with acid reflux or GERD. People with hormone-sensitive conditions should avoid fennel, as it may mimic estrogen. High doses of ginger can cause mouth irritation in sensitive individuals. The European Medicines Agency and other regulatory bodies have established guidelines for many of these herbs, but it is crucial to consult a healthcare professional before starting any therapeutic regimen, especially if you are pregnant, nursing, or taking medications. What's emerging in current research is fascinating. Scientists are discovering that the relationship between herbs and gut bacteria is bidirectional. Herbs influence your microbiome, and your existing bacteria also determine how well you metabolize and benefit from these compounds. This points toward a future of personalized herbal medicine based on your individual gut microbiome profile. The beauty of digestive herbs lies in their accessibility and gentleness. Unlike harsh pharmaceutical interventions, these plant medicines work with your body's natural processes. Whether you are dealing with occasional bloating or chronic digestive issues, incorporating herbs like peppermint, ginger, fennel, turmeric, and chamomile into your routine can provide significant relief while supporting long-term gut health. Your digestive system is the foundation of overall health. When you nurture it with these time-tested botanical allies, you are not just addressing symptoms. You are investing in your body's fundamental ability to heal and thrive. The next time you experience digestive discomfort, remember that some of nature's most powerful medicine might already be in your kitchen.